Hello and welcome back to episode 43 of the Noobie Dentist Podcast. I'm your host, Dr. Omid Azami. In this episode, I sat down with one of Australia's top young dentists based in Sydney, Australia, Dr. Aodhan Docherty. Dr. Aodhan is a University of Sydney graduate who has invested heavily into continuing professional programs and development and is also a practice owner. In this episode, we dive into his early days in private practice and how he made the most out of not having full books at the start of his career. We also talk about the importance of ongoing learning and finding good structured programs and much, much more. I just want to give a big thank you to all the listeners of the podcast. The listener base and the download numbers are increasing month after month, and it is an absolute pleasure to be able to produce content that you guys find value in. Also, a big shout out to all the Canadians and all the Raptor fans listening to the podcast. What an emotional couple of weeks, and after supporting this team since I was a little kid, it is surreal to have witnessed them become NBA champions. So a big congratulations to everyone enjoying it. The podcast is available on iTunes, Spotify, and on my website at NoobieDentist.com. And if you haven't already, be sure to rate us and subscribe to the show. I hope you guys enjoy this great episode.
Hello and welcome to the Noobie Dentist Podcast, the safe place for newbie dentists to connect, collaborate, learn, and grow. The Noobie Dentist Podcast aims to provide high-quality and high-value content for all the newbie dentists out there. With your host, Dr. Omid Azami.
So I'm here with Dr. Aodhan Docherty, who's a general dentist working in Sydney, Australia. One of the core group of clinicians that I've kind of been lucky enough to connect with in Australia. So there's about a group of 4 or 5 of them. Luckily, most of them have been on the podcast with David and Bharat and Johan. And it's been a pleasure, man. I feel like I've had the unique opportunity to actually talk to you guys and see how your careers have kind of progressed, and to try and sort of see what you guys have done to try and like follow in your footsteps, kind of, and put that message out there for the other like young grads as well, so they can have some sort of pathway to get to where you guys are. So thanks for coming on. And you're busy with a lot of studies and work and
lots of studies. Thank you for having me. I appreciate it. There's never-ending study for us.
Yeah, and I think that's the key, right? Because a lot of us dentists, we graduate from school and we're like, yeah, I'm done with studying. So
yeah, after those final exams.
To stay hungry and keep progressing there. So Aodhan, if you don't mind, how I normally kind of start these things is a bit of like an origin story. So tell me a little bit about your story, why dentistry, sort of where you went to dental school, and what kind of techniques from there.
So, thank you for having me. I have kind of always wanted to be a dentist. I think since I was pretty young. It's strange. I'm one of those weirdos since like 5-6 years old. I wanted to actually be a dentist. I think we had really good experiences because one of our family friends is a dentist, so we used to always love going and everything like that. So I was born and raised in Sydney, in around the eastern suburbs, near Bondi. It's called Coogee. There's a beach there. Yeah. So I went to school there. I went to high school. And then I got into Sydney Uni and did a few years of undergraduate med science. Because at Sydney it's a postgraduate degree. So, man, like I remember some of the early days. I didn't even know what I was doing in terms of study. I'm not one of those people that are like necessarily, getting distinctions, smashing things out of the park. Yeah, it was more of a struggle to get through things. And doing interviews and all that sort of stuff. But I essentially progressed through dentistry for 4 years at Sydney. And then I've worked in private practice now for about 5 years. So, yeah, this is all 4 years. This is my 5th. Yeah. So, yeah, it's been a massive journey, a massive ride into, just general clinical work, into practice ownership, into a little bit of teaching and lecturing and stuff like that has been pretty crazy. And lots of postgrad and CPD learning after graduating as well.
Perfect. So tell me a little bit about the dental school experience. What was that like for you?
Yeah, man. Like for me, like some people are like one of my good friends, Johan. The party animals, they smash it. They don't need to study. Yeah. And then other people like me, we're just studying the whole time. Yeah. Like I'm one of those guys who was literally every single night studying, every weekend studying. It's Sunday right now. I'm studying even though I'm not, you know what I mean? Yeah. But I think overall it was a great experience. It wasn't easy, as yours wasn't either.
Yeah.
But it makes you the clinician you are now, knowing what you've been through to get that paper, I think.
Yeah, so you had a good basis in there. I was the same way, man, because in high school I kind of got through. Like I found like school was like relatively easy, like in high school and stuff, and like I didn't have any necessary. Like I had zero like study habits because I just kind of coasted through. And when you get to undergrad and you're like, oh, I have no clue how to study, so like I'm like trying to cram notes and like write things down.
It's weird, yeah.
Make diagrams, like you try everything, right? Until you kind of land.
Until you get your own flavor for it. So that's what I was thinking about this yesterday. How random! I was driving to work, and it was Saturday morning. I'm driving to work at 7 o'clock in the morning. And I'm thinking, shit, I've got exams in 2 months now. Yeah. And I'm thinking, how different is my study approach these days to what it was before? Like in high school, I didn't know what I was doing. Yeah. I somehow managed to just do a shotgun approach and I went all right. Yeah. Then in med science, I met like a good group of now doctors, and they kind of taught me how to study. Yeah. And so how to approach study. And then I went into dentistry and it changed again a little bit. It kind of got more refined every year. Yeah. Every set of exams you sit, you know how you need to study, whether it is diagrams or whether it is, verbal questioning and kind of like almost interview technique to each other of things. And then now for these exams, it's just kind of like every spare hour I get at the end of a working day, I'm just trying to
get something.
Just trying to cram 45 minutes an hour every day. Yeah, exactly. Yeah. Exactly. So that's been my kind of approach, and my way of navigating through dental school and postgraduate or graduate dental school now is again different. It's like so much self-directed. Yeah. I hate that word that they always pull out. Like, guys, you're going to be doing 60 hours a week of self-directed learning. But it really is like you just got to do it, and you got to try and pluck all the papers out of their lectures that they give you, and kind of navigate through
and dive into it. So tell me a little bit about the first few years when you kind of graduated. This is sort of where I'm at now. I'm about like 2 years in roughly. Mm-hmm. And so tell me a little bit about like that work experience. So you get into private practice. Sort of what do you like? What's your mindset at the time? What are you trying to achieve like clinically? Do you have sort of goals of like, okay, in this year I want to like do this and this in terms of CPD, things like that? What was that first couple of years like?
Yeah, they were really tough. It still is, man. But like they were like full on. I don't want to swear on your podcast. I think it was interesting. Like for me, I started doing interviews halfway through my final year of dental school, and no one was doing that at the time. Yeah. Everyone was just like, what the hell is this like guy doing? He's doing interviews like in June and we don't graduate till November. Yeah. But I did so many interviews, and I literally knocked on dozens and dozens of doors all around my area, handing my CV in months and months before graduating. And I ended up getting a few offers early on before I finished. So I was stress-free, whereas a lot of people were freaking out when they're at exam time about jobs because they hadn't got one. Yeah. So I kind of had that under my belt where I was like, well, at least I'll study for exams now, and I've got a job or two. So I ended up I had two good offers. One, which was just outside Sydney, and it was to take on a full book. It was guaranteed money. It was, there was no mentorship. Yeah. And then there was a second job where it was in a new practice, and there was, no guaranteed income, obviously. Yeah. But really good mentorship. So that's with a prosthodontist in Sydney here, Chris Ho. So I ended up taking a position at his practice in the general practice, and I worked there for the first year. It was tough. It was, but it's exactly what you want it to be. It's like what we were speaking about before. It's almost like an internship. Yeah. Like your work is looked at. You're trying to raise the bar, and your photographs are looked at. You bring your cases up. It's really like a full mentorship. Yeah. And at that stage, I was smashing out CPD as much as I could. Mm-hmm. So I flew over and done Newton Fowle in Brazil, did his composite course in Curitiba. So because I wanted composites I wanted to be good at composites. So I went over there and I realized I know like 0.1% of what I need to know.
Yeah.
He freaks me out over there. It was such a good course. Highly recommend it.
How is so sorry to cut you off there, but so with these courses, was that like your mentor kind of telling you like go do this and go do this, or was this like
his recommendation?
So you had that guidance of like, okay, I need to do this and this now.
Well, a bit, it's a bit half-half. Like his recommendation was go and do that. So I went and did that, and I did some. I then went and did Derek Mahoney's course the year after, because a friend of mine who ended up dropping out after one module and left me there to finish it for 2 years. I went and did that on his recommendation. So, for example, I ended up getting into Derek's mini residency, which was a great experience. You know, again, there's good and bad things talked about every program, but I overall think it was definitely worth it for me. It opened my eyes to a lot of things, not just braces, not just ortho, but airway, breathing, sleep apnea, lots and lots of stuff, development. And it gets you looking, you know, so you end up studying a bit more here and there.
Yeah.
So that's another course I kind of did postgraduate as well.
Okay, nice.
Yeah.
So, you know, a lot of new grads may have been tempted by the other position a bit more, right? Because you're coming out of school, you're like, okay, I want to make some money now. Like I've put in my dues. What was that?
I've been studying for 7 years.
I want full books. I want money. So how is like that's a tempting like fork in the road. Like how did you kind of land on that decision? Because like in hindsight, it's probably you did the right thing, right? Like for your career long term, like you invested in that. But in short-sightedly, you'd be like, okay, I want the money maybe. So like how did you just like decide that?
You know, every so often I think about, man, what happens if I did the other? Like if I went with the other job? It's weird. Like I'm so glad I went with the path I did. I suppose I sat down with lots of friends and family and just went through pros and cons of each. And eventually, you know, the thing is like I always think money will come to those who work hard and who play their cards right. But you need to find someone who is going to be willing to teach you and mentor you. Otherwise, you know, you can be just drilling and filling all day, but you don't enjoy it, if you know what I mean, and you don't get your niche. So for me, that's kind of what happened. And luckily I was really blessed in that. From that came some practice ownership as well. So, you know, we've opened a couple of practices in the past 4 years. Which itself has been a big challenge and it's just like a roller coaster ride too.
So we'll get into the practice ownership stuff because I'm like super interested in that. But before we move on, I just want to kind of touch on a few other points. With working, what was, you know, during dental school, did you have like a certain specialty? Did you like surgery more or endo or pros? Was there certain things that you really enjoyed? And were they the same when you graduated and started working, or did those like interests kind of shift and fluctuate a little bit?
Yeah, it's so interesting, Kay. I actually really love doing pros work, and I had an interest in ortho when I was graduating. And so going into that pros practice was a really good stepping stone, because you realize how minimal your understanding is of pros, and how careful you really need to be. So in I started off basically from scratch, and I had no patients. I wasn't taking over anyone's book or anything. So we have an in-house lab with a few technicians in it. And essentially in that first year and a half, man, I was like a technician. I was sitting in that. I was either watching my mentor, because I had say I've got 2 patients a day. Realistically in Sydney, you're killing it if you've got 2 patients a day to start with. Seriously, everyone will BS and say, man, I've got a full book, blah, blah, blah. That's not the case. No. Even in a good practice, you'll start small. And I was watching him when he was there or doing procedures and consults and everything. And the other half of the day, I was literally in the lab and learning from the technicians, because that's something that's so undervalued. And it's given me appreciation for, how your prep is, for example. Yeah. What does the technician look at when he gets your prep, or he or she gets your prep? And what are they looking at? What's their critical analysis of it? Like, to know what they think when they look at a prep, and to get feedback from them about it is just so invaluable. And most of us just send our stuff away, and it just comes back magically. And I've got a crown. Or, sweet, I've got something good. Oh, thank God they could deal with that shitty undercut that I made, or they could deal with that margin that I can't even see, but I still took the impression of. So, you know, from a technician's point of view, it was really cool learning their stuff, because, you know, I then started. If I wasn't happy, if I wouldn't be happy making the prosthesis, for example, I just wouldn't be happy sending them the lab, like the impressions and things like that. If you know what I mean?
Tip,
yeah. So like I was sitting there waxing up things with, man, I was sitting there for like 5 hours a day waxing.
That's so good though, man. I think that speaks to like where you are today, right? Because I mean, I've been in the same boat where you're kind of working and you're not busy and you're seeing like 2-3 patients a day. But the fact that you kind of made the most of that, like I feel like even nowadays, I'm like, sometimes I'm like, I'll just sit on my laptop and I'm like just watching like sports highlights. like, I'm not being productive, you know? Like,
I know.
So when I hear you say that, I'm like, oh man, I should like, when you're in those situations, like it's like try and make the most of it. At least like do some online courses. Like at the start, I would do that. I would sign up, like AGD and stuff, and like do online.
Oh, you know, you give me like a flashback saying that, because that's so weird. I was signed up to Sphere, to Dental Ed, and to Digital, what is it called? Digital XP or something. And I would, the other thing I'll do is I would sit and watch those videos for hours every day. I did that for like 2 years. Oh, geez. It's one of those things where you kind of forget. You just forget when you're like a few years later, you just forget like some of the stuff you used to do. And you're like, shit, I've got to do that again.
Yeah, but that's like, that's the foundation, right? You put in the work and then now it's kind of paying off. So after how long were you like, okay, I'm busy now, like things are kind of like getting going?
Man, like in Sydney, it takes years. It's you know, and I think in Australia and in general, like in most countries, it takes years to get. I'm thankfully comfortably busy at the moment, and I've been that way for probably a year and a half, couple of years. But if I still look back at my book at the start of last year, for example, or a bit before that, I would still have gaps, you know, and it takes time. I would never say to. I get a lot of people who we were looking for a new associate 6-12 months ago. And I get a lot of people that come in and they just demand that they want a full book, or they have the shits that they're not seeing a lot of patients from another person. They're like, I was only seeing 4 people a day. That's the reality. And unless you get yourself a name and you bring in word of mouth referrals, you can spend a lot of money on marketing, direct to patients, etc. But the biggest gem is word of mouth. And if you're a bad communicator, or if you're not interested in trying to grow your practice and you expect your book to be full, you're not going to survive. You're not going to thrive in the community. And that's what I found has been the biggest key. Communication is the key to dentistry these days. Yeah,
for sure. I think communication is like definitely important, but you need the depth as well. You need to know what you're talking about. You need to be able to like go beyond like what I call like the dental school dentistry of just, okay, you got cavities here, you got this and there. To see the big picture and educate the patient on the full mouth like scope of what's going on. And that's like some of that for me, like 2 years, and now like that's starting to start to click now. And that's when you realize like you actually like you were saying earlier, like, man, I don't know anything. Like when you zoom out from like single tooth to like full mouth, like, oh, okay, it's like a whole nother ball game. Like I'm not equipped to like manage this right now. You need to like, that's where you become a bit humble and like you gotta start learning again.
See, that's exactly right. You know, I think in my first year, I thought I was way too good. I thought I was the best. I thought I was I thought I was so good, and I was probably shit. You know, no, I wasn't. Probably I was, and I realized going into second year of graduating that I needed to be more humble, and I needed to take a step back and do more treatment planning. You know, I went over, a good recommendation for anyone listening is I went over to see John Coyce over in Seattle.
Went to the US?
Yeah. So I went to the US and did Coyce, his first and second modules, treatment planning and occlusion. And that rattled me, you know, that was something I then thought back. I did that basically halfway through like my second year in, and I thought, God, what have I been doing for 18 months or so? I haven't been, I don't like the word holistic, but I don't know what else to say at the moment, but there's no holistic kind of approach where you take into consideration everything. I'm talking about diet. I'm talking about social history. I'm talking about everything into making a treatment plan.
Yeah.
Do you know what I mean? Like,
yeah, for sure.
Yeah. And then it clicks.
That's a big one. Yeah. That's started. And, one thing I've like recently started to like click, and I was like, it's like a pretty profound thing that I thought about in my like worldview anyways, is obviously, we're lucky because we get to see a lot of mouths, and when you see kids and like teenagers or like people in their early 20s, you can look at them and be like, I've seen your mouth, what it looks like in a 40-year-old. Because you see like the early stages of like that disease, or the basis is there. And so now you're like, I know your future. I can see it. Like I've seen it. So, and then you can kind of bring it back and tell them like, this is how it's going to go if you don't do this, this, and this. Exactly. And that was like a really cool thing. I was like, oh man, like, because you see like that timeline of common things that people have, like wear and attrition and crowding in their teeth, gum disease and all this stuff. And you're like, you can see the end game. So you can like bring it back now and be like, you still have time. Like you're not there yet. Like let's try and get ahead of the curve now. You
can link it up, hey? So
yeah,
that's what you were saying before. It's like, instead of just looking from the single tooth, he's got a hole there. All right, I'll do a filling, to actually appreciating the whole patient's, stage in life, their situation, and socially, certain factors, things like that. So I feel like after I did COIS, I had more of an appreciation for treatment planning. I was always kind of treatment planning to some degree, like him, because Chris has basically he's finished COIS, all of the modules back in the day. Yeah. So I was kind of emulating what his consultation treatment plan approach was, but it didn't click for me yet. And then after that, I was like, wow, that's what I've been doing, but not as well as I should be. Do you know what I mean? Not as well as I want to be.
Yeah. That's awesome. So what was, in terms of like, so after like 1 or 2 years in, you're doing obviously all these courses, was there luckily you had that mentorship. So he's probably guiding you a little bit, be like, okay, maybe like explore these sort of, domains and like trying to learn more. I'm finding now, I'm like 2 or 3 years in, and you're kind of starting to get a little bit bored of like the basic stuff. Right. And I feel like, it's one thing, that's what I respect about you guys, because you guys just like do it. And so whereas some of us are like, we're thinking about it, we're like, okay, should I do ortho? Should I do implants? And then whereas you're like, oh, we'll just do it all. And then you just like bring it on, and you do the Mahoney course, and now you're
trying to juggle.
So I mean, that's really cool. And that's why you are where you are. Right. But so in general advice for other people, what kind of pathways, like how do people like kind of systemize this a little bit better, of like trying to be like, okay, I need to do these like 4 or 5 disciplines, I need to learn more. Is there like a sequence you recommend? Is there disciplines that, you should like learn occlusion first and then like learn ortho, or like learn ortho and then implants? Is there like any like structure that you can recommend?
That's a great question. And I kind of did things maybe a little bit chop and change, but it kind of worked out. But what I'd recommend to get down pat first is doing some courses or learning from people about documentation.
Yeah,
this is a big David Attia thing. Yeah. If you look at his documentation, it is I swear to God, it's nearly next to no one. It is just that good. And the reason why he is able to treatment plan and do the cases he does comes down to his treatment planning, but it comes down to his documentation, which feeds into his treatment planning. So he's got all the documentation ready. He then is able to treatment plan, and that's something which I recommend you also kind of then do or do at the same time. So that's the kind of John COIS approach, or someone else's. Like he's one of many. Learning how to treatment plan and have it so down pat that it is second nature. For me now, it's taken years, but for me now, I just have the same approach, the same scaffold or skeleton. It changes for everyone because everyone's different, but it's the same scaffold or skeleton, and you can just smash it out of the park because you know what you're looking for, and your nurse knows as well. So you've got a good nurse trained up. It's just it's too easy. Do you know what I mean? I don't mean that it's just easy, but it's much more relaxed for you. You're not stressed. You're not thinking,
it's systemized.
Exactly.
You're not winging it each time. You're boom, boom, boom. Like you got it set up, and you can just kind of tick off the boxes and kind of go through it.
Exactly. And you have that template set out that you fill in, and then you can sit down and you can treatment plan from that. So that's what I recommend as the next step. Then basically it comes down to appreciating restorative, whether that goes into some pros, composites, things like that. I have a big belief that you need to get good at your composites before you're looking at things like ortho and stuff like that. So
basic stuff.
Basic stuff, because we all do it for the first few years, and it's not good enough. You really need to get a better understanding, better depth of knowledge about it, and then that's when you feeding into your periodontal knowledge and things like that, and then you can go into your implants or whatever you might like to do, or your ortho, or something like that. That's kind of the flow that I would give to it. That I put a massive emphasis, as you can probably guess, on occlusion treatment planning and documentation.
Yeah, that's big. So get the base, get the foundation like pretty solid first, and then kind of start to expand from there.
Definitely.
Yeah. If you don't mind sharing, what's your just rough skeleton for your treatment planning? Like how do you approach it?
So for my new patients, for example, I take extraoral, intraoral photographs, DSLR. I will usually have a trained nurse, like one of my good nurses will do those, or I'll do them, I don't mind. And then I sit down, basically, I introduce myself to the patient. The thing that no one does is just have banter with them and have a chat. And that's just so underappreciated, and make them feel at ease. I go through their dental history, reason for attendance, and then medical history and things like that. And then I've basically got a template where I'll sit down and I'll go through tooth structure, gum and bone health, function. So I don't like saying where, but like function has got so many parts to it, and aesthetics. So I break things down like John Coyce-Wilt into 4 kind of areas, 4 or 5 areas, and that simplifies it so much. Everything will come under those to some degree. And then I'll do my examination, x-rays, etc. I'll set them up, and we'll go to a consultation room, and we'll go through everything together, and I'll just logically set it out and discuss what they need to get done. That's my usual approach to treatment planning.
That's a great approach. How much time do you put a lot for these new patient exams? Normally?
So I'll sit there. I like to chat to people. I have to hold myself back sometimes, because like for a new patient just consultation, I'll book off at least 40 minutes or so.
Yeah.
I was speaking to David, I was speaking to Johan. Man, we could spend an hour chatting to people. You don't want to flood them with information, but I think 40 minutes is a good amount of time. And then they can go and see the hygienist. If you don't have a hygienist, then I'll do at one of my practices, I've got a couple of hygienists that I work with. So the hygienist will see my patients. At the other practice, I don't have a hygienist for 1 or 2 days a week that I'm there. She's only there part-time. So I'll still do the new, like the cleans and everything, which I don't enjoy that much, but I still do enjoy doing perio work and stuff like that. Like I do heaps of perio, and I absolutely love it. So, the more time you spend with the patient, the more they get to know you. So it's not a bad thing if people are like, "Oh, I don't have a hygienist." Like, I'm not killing it. I don't have a hygienist. Exactly. Like that's how you build a relationship with someone, is time. It's easier to build a relationship when you're doing your own hygiene, I think, than if you're not, because you've got more time with them.
Yeah. For sure. What's it like now that you've been getting into practice ownership, and like what's that current situation? So are you like part owner in like multiple practices, or?
Yeah, so I've got part ownership of 2 practices, and it's not all it's worked up to be practice ownership. It's freaking hard, man.
It's a lot of work,
it's like juggling everything. I sit down and think, far out. Like if I was an associate only, it'd just be a walk in the park. It's seriously tough. It's
do you enjoy the business side of it, or obviously you're like a pure you're a clinician person, like you like the clinical side of it a lot. You get any of the juices flowing for the business stuff, or not really? It's just like something you got to do.
That's a tough question. Like I feel the reward of growing a practice, and it's just it's such a challenge. And I do enjoy it, but I enjoy primarily being a clinician. Like that's just something that you can't override. I do think it's amazing to grow a good team, have everyone work close together. It's tough managing people. That's not easy, and that's something you don't get taught. Managing a lot of people and it's like juggling. It's a something it's a skill, and it's something you learn. That's all you can say. It's like dentistry. You learn as you go, and you get better as you go. Exactly. It's all about leadership.
Do you spend a lot, like, obviously you're very heavy into like CPD and stuff and like trying to better yourself as a clinician. Do you spend anywhere like near that amount of time on leadership skills and like management skills and things like that? Or is that something that you're just like learning on the job as you go along?
I suppose I'm lucky that I've got my business partner there, and he's done this for like 20 odd years now. So I'm learning from him and how he manages staff and how he manages his businesses and stuff like that. And I've got his wife also who helps run the business and looks after all the account side of things and day-to-day runnings and stuff like that. We've got some managers and things like that. So I'm lucky I've got lots of people to bounce things off and learn from. It would be a different story if it was just me by myself, I think. So I'm really lucky in that respect.
That's awesome, man. I think it's been a really good episode. It's been nice chatting with you. And I think there's been a lot of great content that I'm kind of taking away, and I'm sure other people will get that too. Some of the big themes that I'm picking up from, chatting to you guys, yourself and Johan and Bharat and David is, one is like that hunger to like keep going with the CPD, make that a thing that like, okay, I need to learn more, I need to get better. And two, I think is like the patience. A lot of us, like me included, we might get that short-sighted thing of like, okay, I'm not making like X amount of dollars, or I'm not doing this right now. And you kind of get like down on yourself a little bit. It's really refreshing it's been refreshing to hear you say, okay, I sat in a practice, maybe seeing like one or two people a day for a long time. But you made the most of it, which is nice. I mean, you weren't just kind of just like sitting around like upset and like wasting time, but you're being proactive and being
waiting for someone to walk in.
Being in the lab and kind of trying to learn as much as you can to at least make your time worthwhile that way, right? So I think that's really respectable, and obviously it's paying off now because you're kind of enjoying the fruits of the labor, so to speak. So one last thing I want to kind of touch on is obviously, with the podcast, I've been doing a lot of episodes, and I've been, lucky to chat to a lot of people who are doing a lot of great things in dentistry. And one of the common themes has been, structured learning. Yourself, Bharat, David, all those guys, Johan, you're going through these like post-grad sort of structured learning programs. Tell me a little bit about the Sydney sort of like grad dip program that you're doing now, and kind of what doors that's kind of hopefully opening up for you down the line.
So I'm basically in a practice which focuses on a lot of implants. So it's an implant-based referral practice like that I'm associated with it. Like I don't work for it or anything like that. That's the specialist side of things. But I see a lot of implants get placed and see the treatment planning side of things. And I wanted to delve into that myself. I'm always quite cautious. So I didn't want to do it without any learning, even though I've been there for going on 5 years, learning from someone who places them every day and is very, very good. Yeah. So his recommendation was to have some university behind, learning behind me. And I think that's been really key for me, because you need to, it's my belief that you need to learn the literature and you need to have an understanding and an appreciation of that. Yeah. To be a clinician. You can't just cowboy it and jump in and think that you're going to be able to place implants after watching a couple of Facebook videos, YouTube videos, the ones, like all the ones I'm talking about, Instagram videos. Yeah. There's so much to it. And so essentially I went about 18 months ago into the University of Sydney postgrad program. Yeah. It's a 18-month 2-year program where we have 6 blocks, and each block is about a week or so. So there's a 6 weeks or so where you have to take it off work. So it can be tough from that respect. Every 3 or 4 months or whatever it is, you're taking a week off. But in that week, you've essentially got 5 to 6 days, it's Monday to Saturday usually, of intensive lectures. You're sitting there from 8 o'clock in the morning till 6 o'clock at night, and you're having lecture after lecture after lecture, or you're doing some hands-on or watching some live surgeries and things like that. There's assignment presentations, so you have to present in front of the class, but also some assesses some of your clinical work. You're also given 2 mentors who you have to do all your clinical work with, and your clinical requirements go through. So it's not a walk in the park or anything like that. It's not it's not just commitment. It is a massive commitment, but I think it's well worth it, because at the end of the day, I'm coming into the last 2 months now, or just under. Yeah. and I've got, I'm just freaking out now saying that. I've got a set of exams and a set of vivas which I need to sit.
Mm-hmm.
And you're treated like a postgrad student. You're not treated, you're treated like a university student. You're grilled. You're put through the ringer. So by the end of it, you know your stuff. You're never going to be as educated as someone who's done postgrad pros or perio.
Yeah.
I would never ever say that. But it's a good stepping stone. If you want to do that, you can do that. Or if you want to incorporate implants in your practice, you can, because you're well equipped to place implants. They show you the cases which you should be doing, or the cases should be comfortable doing, I should say, or which you shouldn't be comfortable. So they tell you, what you should be striving to do in clinical practice and what you should be referring. So that's been my approach. I'm really a literature-based person who doesn't take risks and who will have someone work with me, mentor me and things like that. And I think that's an approach which has kept me in the safe zone a lot, but also has helped me progress and learn a lot in the meantime.
That's great. With the clinical stuff, is it stuff that you have to kind of take away and do it in your own practice and just document it and bring it back into the course? Or do you get clinical time at the dental school, like facilities to do implants and stuff there?
So all the clinical work you do, you have to block out of your own time and do it at their mentors' practices. Okay. So basically, I do all the surgeries with a periodontist, and I do all my restorative components with a prosthodontist. That's so amazing. They give you, it's next level, and the perio in the city, Robert Fell is just so good. And the pros is Robin Hawthorne, who's, probably the most famous pros in Australia. He's just amazing. He's, the grandfather of pros sort of thing. So they have access to allow us to see these people and be mentored by them, and they want you to learn. It's not like they're just doing it for the sake of it. Do you know what I mean? They're teaching you. They're really teaching you, and you think, like, how nice is that to give their time? They don't get paid for it or anything. Yeah. I'm sitting in their practice doing implants when they could be doing implants, or seeing patients in their chair while they could be seeing them. So that's the clinical side, and you need to have everything by the book. It has to be perfect for them to tick you off. Yeah. That's awesome, man. I think that sounds like how big is the cohort? Is there how many people do this every year? It started off as 22 and went down to 14 probably. Oh, wow. It's a big attrition. Yeah, man, because it's a lot of commitment, and people started dropping off like flies at the start. I was thinking, oh, geez, what am I doing? Because obviously it's not cheap. It's not a small investment. It's $50,000-$60,000 to do this. And if you drop out, that's it. You don't get it back or anything. Oh, it's non-refundable. And it's a lot of time. So it's all in sort of thing. You have to commit to it. And I would recommend doing that. Obviously, only doing it when you're really ready. If you know that you've got 18 months to knuckle down and do it. Yeah, that's pretty cool. Is there people from outside of Sydney that do that course, or is that everyone that's pretty local? Do people from Melbourne fly down and do it? Or I'm one of the only ones in Sydney. We're only three of us in Sydney. Most people are from Melbourne, Queensland, rural New South Wales. Those are the kind of three states that everyone's from. But I'm basically one of the only ones from Sydney. Yeah. Yeah. Awesome, man. I think that sounds exciting. I think I'll look into it. I'll put a link up anyways in the show notes if anyone's interested in kind of checking it out. I agree with you guys. I think something that I've been thinking about a lot is, if you want to do it and if you want to do it well, be it pros, be it aesthetics, be it implants, you need some structure behind you and some depth behind you. It's tough to go to a weekend course and be okay, now I can do veneers. Right? Yeah. So I think you need that so you need that depth and breadth kind of behind you, which is awesome. So thanks again. Thanks for coming on. What I normally like to do is just kind of end off with a quick rapid fire, just to kind of lighten things up, and we'll wrap it up from there. And you got to get back to your studying. So what's your favorite pizza topping? Oh man, I'm pretty simple. I like Hawaiian pizza. I have it once a week. A large have a pineapple pizza. Yeah, boom, love it. It's a Canadian invention, which is cool. So, what if you weren't doing dentistry? What career would you be in? I reckon I'd be a builder. Builder, yeah.
what's your favorite like musician or artist or band?
Oh man, I love a bit of Jay-Z.
Jay-Z, nice.
Yeah.
Yeah, he's good.
100%.
What's one procedure in dentistry that kind of makes you question your career choice?
Probably endo.
And it's the most common answer for sure. Yeah.
Oh, seriously. Yeah.
And what's your favorite tooth to work on?
Oh, I love a good central incisor.
Yeah.
You cannot beat it.
Yeah.
Composite on a central incisor.
Yeah.
Happy days.
Access and yeah. Awesome, man. Thanks for coming on. It was a great chat. I think there's definitely a lot of good content in here. I think a lot of people get some great value. I'll put a tag to your Instagram account as well, which is growing, and you're posting a lot of great content.
Thank you.
I think it's at Dr. Aodhan. I think Dr. Aodhan, right? So
that's it.
People will check it out, I think, and hopefully they can reach out to you as well if they have any questions or want to kind of get more advice and things like that. I think that'd be pretty cool.
Always welcome. Messages or questions or having a chat about certain treatments or treatment plans and stuff like that. I'm always happy to have a chat. Yeah. And I appreciate you having me on here.
Yeah, awesome. Thank you.